Good morning. Welcome to Coffee with Chosen. My name is Staci. Many years ago, I was on a trip in a third world country. On this trip, I experienced countless things that were really scary. I was traveling in a time before there were cell phones and email, and it was really hard to even get a call out from the country that I was in. My family members back home had no idea what I was going through. When I did get home, I started to tell the stories of what I went through to the rest of my family. Months and even years later, I was still telling those stories to my entire family, even though they had already heard them. I didn't know it then, but I do know it now, that I was telling stories to calm my fears. Dr. Dan Siegel, a neuropsychologist and author of the book, The Whole Brain Child, calls this technique, Name It, to Tame It. Children experiencing scary things have big emotions with tummy flips and tears that flow freely. Those things come from the right side of the brain. When the right side of the brain takes over, all logic and reasoning goes out the window. When I was telling my stories, I was home and I was safe. I had made it through. But the left side of my brain, the side that is logical, had definitely gone offline. I was consumed with the emotions of the memories I had from the trip. Well, as parents of children with trauma, we have the opportunity to help the left and the right sides of the brain work together, or, as Dr. Siegel says, integrate. How do we do this? We help children and teens retell the story of a frightening or a painful experience. My family listened to me tell the stories over and over again. As I named what had happened, I tamed the emotions, and the logic or the left side of my brain helped me to be able to say and believe, yes, that trip was scary, but I made it and I'm home now and I'm okay. Having our kids tell the stories of their painful or frightening experiences helps the two sides of the brain come together to make sense of what happened. Whether it's falling off a bike and getting hurt, or something more serious like abuse a child has experienced. Recounting what happened helps kiddos get further down the path of healing. Simple phrases like, "Tell me about that bike accident," gives children permission to begin the storytelling. Asking them how it felt when they fell off the bike continues the process and helps them express fears so they can get on a bike again someday. After a meltdown that seemed to come from nowhere, ask your kiddo, what was happening inside when you were having that come apart earlier today? Did you remember something scary? Draw the story out as best you can. Ask them about feelings. Assure their safety in the present moment, and they'll feel safe because you're listening. Not all children are going to be ready to tell their stories. Don't force it if they're not ready. Some children are going to feel safer doing that in a therapist's office. But Name It to Tame It can be an extremely effective way to get that left and right brain working together, which is an essential part of child development after trauma. Don't hesitate to read The Whole Brain Child by Dr. Dan Siegel and Dr. Tina Payne Bryson for more information on making the left and right brain work together. Our website also has many resources on brain health, especially for children who have experienced trauma. Have a great day.